A 29-year-old man reports feeling persistently anxious and fearful in social situations. He avoids parties, meetings, and other social gatherings due to intense anxiety and fear of embarrassing himself. Question: what is the most likely diagnosis for this patient? A. Panic disorder. B. Generalized anxiety disorder. C. Social anxiety disorder. D. Obsessive-compulsive disorder. Answer: C. Social anxiety disorder. Explanation: the patient's symptoms of fear and avoidance of social situations, as well as fear of embarrassment, are indicative of social anxiety disorder. Panic disorder involves panic attacks, generalized anxiety disorder features excessive worry, and obsessive-compulsive disorder involves intrusive thoughts and compulsive behaviors. A 65-year-old man presents with shortness of breath and a cough. He has a history of COPD. The physical examination reveals a barrel chest. Which of the following is the most likely diagnosis? A. COPD. B. Asthma. C. Pneumonia. D. Tuberculosis. E. Sarcoidosis. Explanation: a barrel chest is a physical finding that is characteristic of COPD. In this case, the most likely diagnosis is COPD. Asthma, pneumonia, tuberculosis, and sarcoidosis are also possible diagnoses, but they are less likely in a patient with COPD and a barrel chest. A 12-year-old female presents with episodic flank pain, hematuria, and abdominal mass. Imaging reveals multiple bilateral kidney cysts and a hepatic cyst. What is the most likely diagnosis? A. Wilms tumor, nephroblastoma. B. Autosomal recessive polycystic kidney disease, RPKD. C. Neuroblastoma. D. Renal cell carcinoma. Answer: B. Autosomal recessive polycystic kidney disease, ARPKD. Explanation: the presentation of episodic flank pain, hematuria, abdominal mass, and the imaging findings of multiple bilateral kidney cysts and a hepatic cyst are characteristic of autosomal recessive polycystic kidney disease, ARPKD. A 10-year-old male presents with gross hematuria and abdominal pain. Physical examination reveals a palpable mass in the abdomen. Imaging shows a large, solid renal mass with calcifications. What is the most likely diagnosis? A. Wilms tumor, nephroblastoma. B. Renal cell carcinoma. C. Multicyclic dysplastic kidney. D. Neuroblastoma. Answer: A. Wilms tumor, nephroblastoma. Explanation: the presentation of gross hematuria, abdominal pain, and a large solid renal mass with calcifications is characteristic of Wilms tumor, nephroblastoma, the most common pediatric renal tumor. Scenario: a 35-year-old woman has been experiencing periods of extreme sadness, low energy, and loss of interest in activities, followed by periods of elevated mood, increased energy, and impulsive behavior. These episodes have been occurring over the past several years. Question: what is the most likely diagnosis for this patient? A. Major depressive disorder. B. Schizophrenia. C. Bipolar disorder. D. Borderline personality disorder. Answer: C. Bipolar disorder. Explanation: the patient's history of alternating between periods of depression and elevated mood, along with impulsive behavior during manic episodes, suggests bipolar disorder. Major depressive disorder involves only depressive episodes, schizophrenia involves hallucinations and delusions, and borderline personality disorder involves unstable relationships and emotions. A 2-year-old female presents with a febrile urinary tract infection, UTI. Imaging reveals a dilated ureter and pelvicoileal system on the affected side. Voiding cystourethropy, VCUG, shows no reflux. What is the most likely diagnosis? A. Primary megaureter. B. Vesicoureteral reflux, VUR. C. Posterior urethral valves, PUV. D. Neurogenic bladder. Answer A. Primary megaureter. Explanation: the presentation of a febrile UTI, dilated ureter, and pelvicoileal system with no reflux on VCUG is suggestive of primary megaureter. A 50-year-old man presents with shortness of breath and a cough. The CT scan shows ground glass opacities in the lungs. Which of the following is the most likely diagnosis? Ground glass opacities CT scan. A. Interstitial lung disease. B. Pneumonia. C. Tuberculosis. D. Sarcoidosis. E. Lung cancer. Explanation: the most likely diagnosis in a 50-year-old man with shortness of breath, a cough, and ground glass opacities on a CT scan is an interstitial lung disease. Interstitial lung disease is a group of lung diseases that affect the small airways and the lung tissue. Pneumonia, tuberculosis, sarcoidosis, and lung cancer are also possible diagnoses, but they are less likely in a patient with these symptoms. Scenario: a 30-year-old woman reports feeling persistently anxious and worrying excessively about her health. She often fears that minor symptoms indicate serious illnesses and frequently seeks medical attention for reassurance. Question: what is the most likely diagnosis for this patient? A. Generalized anxiety disorder. B. Illness anxiety disorder, hypochondriasis. C. Panic disorder. D. Social anxiety disorder. Answer B. Illness anxiety disorder, hypochondriasis. Explanation: the patient's symptoms of excessive health anxiety, fear of minor symptoms indicating serious illnesses, and seeking medical reassurance are indicative of illness anxiety disorder, hypochondriasis. Generalized anxiety disorder involves excessive worry, panic disorder features panic attacks, and social anxiety disorder involves fear of social situations. A 6-month-old male presents with a urinary tract infection, UTI. Imaging reveals a dilated posterior urethra and bladder, along with bilateral hydroureters and hydronephrosis. What is the most likely diagnosis? A. Posterior urethral valves, PUV. B. Urethral stricture. C. Vesicoureteral reflux, VUR. D. Neurogenic bladder. Answer A. Posterior urethral valves, PUV. Explanation: the imaging findings of a dilated posterior urethra and bladder, bilateral hydroureters, and hydronephrosis are suggestive of posterior urethral valves, PUV. An 8-year-old female presents with urinary urgency, frequency, and nocturnal enuresis. Imaging reveals a small bladder with thickened, trabeculated walls. Urodynamic studies show detrusor overactivity. What is the most likely diagnosis? A. Vesicoureteral reflux, VUR. B. Neurogenic bladder. C. Idiopathic overactive bladder. D. Posterior urethral valves, PUV. Answer C. Idiopathic overactive bladder. Explanation: the clinical presentation of urinary urgency, frequency, nocturnal enuresis, a small bladder with thickened, trabeculated walls, and urodynamic studies showing detrusor overactivity is suggestive of idiopathic overactive bladder.